My presentation is about the ADHA's federal advocacy efforts. Objectives: learn what federal advocacy is and what it can look like. Examples of historical federal advocacy efforts to better understand the concept. Discuss examples of ADHA's participation in federal advocacy and an idea going around for federal advocacy. So, federal versus state. A federal system of government is one that divides the powers of government between the national, federal governments and state and local governments. So, ADHA, which is what we're talking about, is national, and ARDHA would be for Arkansas and that state. Federal advocacy is the act of supporting a change or creation of an issue on a federal level. There's several ways to participate: emails, calls, letters, social media posts, community marches, and signature campaigns. Some more examples of federal advocacy is Martin Luther King Jr. and Susan B. Anthony, who is a women's rights activist, and Arkansas Advocates for Children and Families. This group's mission is to ensure that all children and their families have the resources and opportunities to lead healthy and productive lives and to realize their full potential. The ADHA works with policymakers and promotes policies to allow hygienists to work to their full extent. Some examples is the legalization of RDHs giving local anesthesia in Texas. This is not legal currently, but they are working on it. License portability to work across state lines, and adding oral health coverage to Medicare Part B. This would allow 61 million older adults and people with disabilities to have access to care. The ADHA participated in an article titled 5 Health Issues Presidential Candidates Aren't Talking About But Should Be. And they discussed the importance of dental hygienists, the connection to oral health to overall health, how too many citizens do not have access to dental care, and the ADHA advocates for communities with their community service grant programs. An example is Healthy Start for Texas Teeth Community Service Grant. So here's the advocacy idea that's floating around. It's the legalization of hygienists administering dental Botox. Currently, only medical doctors, nurses, and physician assistants are allowed to inject Botox. There is currently a petition started by Kendra Tenney with over 10,000 signatures, and there's the link. Their argument is that hygienists have enough education and they could add on courses that would certify us in this area, how we have with local anesthesia. And those are my references.